Hey, Adventure Riders, my name's Mark with Keith Remoto, and we are going to do our second part of Rider Down, which is basically coming up with a plan how to mitigate a injury or a crash or anything like that when you're on your adventure motorcycle trips. But first, we're going to talk about a few things because I touched on it on the last video a little bit about first aid kits and things like that. But I really, this is in response to reading the Moscomoto blog, which is great. Those guys, what they're doing over there is fantastic. And they talk about first aid classes and, all that sort of stuff. But I really want you guys to get the full picture. I'm a retired fireman. I was a paramedic for 35 years. I was also a wilderness paramedic in the Mount Hood National Forest in the 1990s. I've participated in a lot of different rescues and medical responses and things like that. So I've got real hands-on background from this, right? So, and I was also a trainer for volunteer firefighters and blah blah blah, right? But trust me, I kind of have some experience in this um, realm of knowledge, right? So let's talk about a few things. So this is not a first aid class, right? Go take a first aid class. I mean, nothing can hurt for sure. Absolutely, take a wilderness class. Remember we've talked about whether there's certifications or ongoing. If you get certified, is there ongoing training that you have to do? Is there an annual or biannual certification type of thing? But anyways, my objective here is to give you a basic understanding and a framework on first aid concepts, right? So if you understand the concepts, you can apply these things, okay, instead of just learning how to apply a bandage or a SAM splint or a tourniquet or secure a fracture. But the most important thing is really assessing what the level of injury is and then transferring that to the first responders that are coming to you if that's what you choose to do. So again, I'm not trying to inhibit definitely what the Moscomoto guys are doing and definitely what you guys want to do. Take a first aid class. It's really great general knowledge, but I want you to know 100% of the story. So first of all, there's first aid kits, right? You can order so much stuff in first aid kits, right? And there are various levels. So determine what your level is and apply, carry the first aid kit that makes the most sense, right? If you've got someone that has background in emergency response, emergency EMS type of stuff, EMT level stuff, yeah, they're going to carry a little different kit from someone who has no experience whatsoever and has got a bunch of Band-Aids and Neosporin and stuff like that. So first aid classes, there's various levels too. There's the Knowles Wilderness EMT classes, Wilderness First Aid classes. There's all sorts of things, and that teaches you how to really just use what you have and what's around you in order to apply first aid concepts, right? So take first aid classes, look them up, Google them, things like that, and then once you get, you take your first classes and you feel more comfortable with your skill level and things like that, then you can up your level of first aid kits. And I talk about the first aid kit that I carry in the previous video, which I hope you guys watch. And then there's hands-on training that teaches you the skills needed to perform first aid tasks, right? Splinting, immobilizing the neck, taking off a helmet properly, right? Being able to put an extremity that's got an angular a fracture to it, maybe in the neutral position, how to do that, how to apply traction to a lower extremity femur injury. Okay, there's all sorts of tasks. How to take a pulse, right? How to do an extremity assessment. Is there any numbness and tingling? Can you move your fingers? Can you squeeze my hands? Things like that. That's really, really good stuff, right? But you also need experience applying those skills. And I'm going to tell you right now, and this is the truth, there's a big difference between taking a class and having somebody teach you the skills and then applying them on someone who is in true, real distress, a real patient. Okay, there's a big jump there, right? Now, most people that take first aid kits are not going to, they're not going to go out and find people in distress so you can go around and apply your skills, right? Unless you want to become a professional EMT or firefighter or volunteer with your local fire department, stuff like that. You can get some experience in there. But what I'm saying is that you've got one, you can either do it on live patients, whether you do, or the first aid class that you do offers a clinical, right? So when you get your paramedic license, at least in my experience, mine was 6 months full-time, 6 days a week in the classroom, and then full 6 days a week in a hospital doing clinicals, learning how to put in IVs and do intubations and splinting and assessments and all that stuff. You basically worked right in the emergency room, right? So a lot of people can't do that, right? A lot of people don't have that opportunity. So come up with some scenarios, right? And I think my friends over at Moscomoto, who I love their products. I have Moscomoto on all my bikes. If you get the opportunity when you do your trip and your pre-trip planning, come up with a plan on if something happens and someone gets injured, what are we going to do? And then run some scenarios, right? Most of the time, you're talking about maybe an extremity injury, right? So come up with a scenario, and that means somebody role play an injury, lower leg injury or whatever, and go through and run those scenarios that you learned in your classes. And hopefully in your classes, you're doing a bunch of these scenarios as well. It is the next best thing to actually performing on a live patient. Okay. And I mean a live patient that is in true, real distress from an actual injury. Okay, so I want you guys to get kind of get that part of it, because there's a big difference between learning a skill in first aid and applying it on someone who is really injured. Because we talked about sometimes the best medicine you can do is just talk in a nice low voice and be reassuring and say, we're going to get through this. And, we need to do a couple things in order to get you from point A to point B. We've got people coming along the way, the first responders, and then able to determine the level of injury, which is exactly what this video is about. Okay, got it? So leave comments. If you have any questions, I'll try to get to them. I'm just learning this whole YouTube thing. So if I don't get back to you right in time and things like that, let me know for sure. So first aid and training classes and stuff like that, you can get together with your buddies and do these scenarios. But I'm trying to prioritize the big picture in order to move your scenario to a good result, right? So there you go. Okay, let's get going here. So I threw this slide in again to just let you know this is what I carry in a general sense, and I want to pick out some things for you, right? Large Band-Aids, right? Little Band-Aids tend to be like, whatever. But large, I got a large Band-Aid here for whatever. I carry a burn kit because it can use for multiple things, right? It came in the kit and I carry it. It can be used on a lot of different things. A chest seal, right? Chest seal is designed, this is advanced stuff, is if you got a hole in your chest, you want to have negative pressure inside so your lungs can inflate. Gunshot wounds, things like that. Do you probably need that? Well, I certainly hope not, right? So, but they can be used for multiple things. They have like a Vaseline type of stuff impregnated in the fabric, and it can really cover a wound really well, and it's sterile, and you're not gonna hurt a wound by doing that. Here I've got a 100 cc syringe, potable water, right? get it out of your water bottle or whatever, potable water, and irrigate out a wound that's dirty, right? Dirty. If it's got dirt in it, if it's an open fracture, anything like that, it doesn't need to be, essentially doesn't need to be sterile saline. Okay, if you want to carry it, go right ahead, but it doesn't have to be. It can just be as much irrigated as much as possible, and then cover it, wrap it, cover it, and don't ever take bandages off. Just keep adding more bandages on it if there's enough bleeding where you have to apply more pressure, right? And then there's an assortment of different dressings, things like that. There's a nasopharyngeal airway over here. If someone's having trouble breathing due to an injury, there's gloves. I mean, these guys list some things really good. I've got a multi-tool scissors here. Cold packs for hot weather, right? Cold packs, we talked about that for hypothermic or heat injuries. You know, becoming heat exhausted and somebody needs to cool down. You know, they're also really good for pain control. Just make sure you don't put them directly on the skin. Just put them in a sock or something like that, and it will help. Hand warmers. I use hand warmers in my gloves. I don't have heated gloves and things like that, and they work pretty well. If somebody's cold and the accident happens to be in the early morning when it's really cold, give them a couple of hand warmers. They last longer than you think. I mean, they're really good. Emergency compression bandage. I have great success with Leukotape, right? Leukotape is what you see on athletes wearing on their elbows and their things like that to kind of keep their ligaments and stuff like that. It sticks really well. Really well. Your hair is going to come off when you take it off, okay? But it's really super good with blisters. It's really super good if you got to put a sand splint on or something like that. You don't need a ton of it. Ace bandages, cling wrap. If you have just a out bandage, cling wrap is like an elastic type of ace bandage, if you will. Here, kind of hidden, is a tick removal kit. I have a whole video on how to treat your clothing to keep ticks from invading your blood supply, things like that. I've got some suture glue, essentially glue that glues your fingers together, your skin, right? I mean, you can use it on wounds and things like that, but mainly what I use is sometimes I get the dried out type of things on my cuticles and things like that, and I just glue them up, and they're really good. More importantly, okay, is a pen and paper, right? If you find something, write it down, right? The first responders are going to want to know, right? They are going to want to know. And then also protect yourself from hazard type of stuff, blood, you know, bodily fluids, things like that. Wear a mask. You know, if you got a mask, wear a mask if you can. Q-tips for various things, taking bugs out of ears or whatever. You can also use a syringe for that with some warm, you know, water, things like that, gently. Okay, right, really good. So that's essentially what I carry, but I have another little kit that I bring just by myself. If I'm riding solo or whatever, I'll just bring a very small kit for minor abrasions and things like that, which I'm sure there's plenty of YouTube things like this. This is filled with Castile soap, Dr. Bonner's Castile soap. That's the only soap I use. So there you go. All right, an overview. We talked about this in the previous video. We're going to overview really super quick. Calm approach to care. Calm approach to care, right? And it's an emotional thing. Nobody likes to see somebody else in distress. Be calm. Be calm in your approach to the patient. Lower your voice. You know, we're going to take care of you. Things are going to be just fine. We're going to get you to a hospital. We're going to, you know, things like that, right? I mean, just be nice and calm, be reassuring, okay? Protect the patient and protect you on scene and all who are on scene. So important, okay? You're on a road in Eastern Oregon in the middle of nowhere on a blind hill, and someone falls down, you know, slips and slides down the pavement on, you know, some gravel or something, and you've got a lot of truck traffic to come through there, right? Commerce and stuff. So Get somebody up the road to flag people down, slow people down. If you got to move the patient, you got to move the patient off the road, right? You got to move them, you got to move them. And just be careful in moving if you can. Just be as careful as possible. And protect yourself, make sure somebody's securing the motorcycle. Make sure you're protecting yourself from the wind, the wet, the cold, and solar radiation. Okay, we talk about this a lot, right? I want you guys to protect yourself, protect the patient. If it's a middle of the desert and it's mid-July and you've got high solar radiation, high heat of the day, protect the patient from the sun. Get the patient out of the sun. Use your sun umbrellas. We talked about that in previous videos as well. Or get a tarp or something in order to protect the patient. Again, protect you, all who are unseen, and protect the patient. Protect, protect, protect. Okay? Someone needs to take charge. This is not in your first aid kit, not in a first aid class. Okay? This is scene management, right? Someone needs to take charge. All right? So whoever is either your most experienced guy or whoever you determine, Diane would be the best person to take charge if somebody gets hurt, all right? Or if Diane gets hurt, maybe Sam would be the good person to get to be in charge. Whoever's like really organizationally gifted, right, or whatever, take charge. Someone you respect who can delve out roles and responsibilities. You're going to take care of the patient. You're going to go up the road and make sure nobody runs us over. We're going to move the patient together. You're going to take care of this and get people working, get people rolling. Nothing decreases the stress of the situation with better than people who are trying to accomplish tasks. So that's what the person in charge is. We call it the scene commander, right? Determine the level of injury. We're going to talk about this. We're going to talk about primary survey and secondary survey. All right. This stuff's not in your first aid kit, and it's briefly part of your first aid class. Everybody wants to apply treatment to someone, right? Remember, do no harm, right? Everybody wants to apply these things. But the most important thing is you got to determine the level of injury and determine whether you need to do an acute action, something that needs to be done now, or something that can wait. Okay, so we're going to talk about this. That's the whole purpose of Rider Down Part 2. Make a plan. You guys get together collectively and make a plan. Accept all suggestions. Hey, I think, this guy just pulled over with a pickup truck. We should probably take him to the next town. Or, well, all right, we've made in contact with first responders. They're 3 hours out. And we can make it to the next town that's got a clinic, or whatever you guys decide. My point is, make a plan and then execute the plan. Okay? Calm approach to care, protect the patient, all who are unseen, take charge, determine the level of injury, make a plan, and execute the plan. Right? None of this has to do with first aid. All of it has to do with mitigating the situation. So determining the level of injury. We're going to get into the weeds a little bit, but I'm going to keep it in the upper atmosphere, okay? I don't want you guys to apply treatment or apply care if you're not absolutely 100% sure you're going to have a positive result, because remember, do no harm, okay? Or you're not feel comfortable enough with your skills in order to do that. If I, being a retired firefighter paramedic, had came across a bicyclist who fell off his or her bike and was complaining of a leg injury, and I had the ability to splint it, I would say, young lady or young man, do I have your permission to splint your leg? And they would say, yes, splint it. Because splinting reduces pain, right? It reduces that agony when it comes to a fracture, because fracture movement is what causes most of the pain. Okay, so anyway, just to let you guys know that. So the objective here is to gather enough information to create an appropriate plan and carry it out. You are detectives. You are first aid detectives, and you are trying to figure out what the level of injury is. Most of it can be very obvious. Some of it is not. Okay. Determine whether the injuries are life-threatening or non-life-threatening. Okay. 99.9%, God forbid, is 99% of it's going to be non-life-threatening, right? And so, that is good. All right. That is good. And I hope the best for all of you out there if something happens. But, adventure motorcycling on trips, motorcycling in the backcountry is a high-risk sport. It may be difficult to request the appropriate response from agencies when you are unable to determine the level of injury. What does that mean? Right? You are unable to determine the level of injury. You call first responders and stuff, and they're saying, we're going to order a helicopter, or we're going to, this response is probably better. It's far out, whatever. It's difficult. It's difficult. So if you can determine the level of injury and say, I have a 55-year-old male who slipped on some gravel, slid down on pavement. We have him in a safe area. He's complaining of a right lower leg injury, no other issues, no neck pain, no loss of consciousness. He's not complaining of any breathing. He can move his toes on that extremity. We believe this is an isolated injury to the right lower leg. That's a big difference, right? Because that patient can get in the back of a side-by-side or a pickup truck or anywhere and go to the nearest hospital and probably be treated very successfully. As opposed to, I've got a 55-year-old male who went off the road and struck a tree at a moderate speed. We're estimating about 40 miles an hour. He's unconscious. He or she is unconscious. Okay. I've got an angulated fracture of the lower left femur area, upper leg, or things like that. And you're painting a picture of this person really had a high degree of mechanism of injury, right? We talked about that. We talked about mechanism of injury. What happened? Speaking of that, right? So mechanism of injury, what happened? Right? What happened? Describe the scene that led to this situation. Describe it. What happened? Did you see it? Was it unwitnessed? Right? You should be in the buddy system anyway, as far as I'm concerned. That's my opinion. But what happened? Were you doing a river crossing and you lost control of the motorcycle on the way out and flipped it over, and the motorcycle fell on you, and you're complaining, of chest injury or pelvic injury or something like that. You guys all know what the body's made out of, right? So describe what happened. Simple. Okay? And write it down. So your primary assessment is your first look. I want you guys to realize the biggest asset that you have for first aid anywhere. You could be a seasoned paramedic. You could be a firefighter in Boston Fire. You could be a seasoned medic in San Francisco, California. You could be a person taking the first aid class because you're an adventure rider and you want to take the first aid class, right? Anyone. Use your eyes, all right? Assess with your eyes before you even make contact. As soon as you start walking up that patient, what do you see? Okay, use your eyes. Okay, I see a patient lying on the ground in major distress, really in agony because they're clutching their right knee, and that will tell you most of what you need to know. But use your eyes. The most important thing, use your eyes. All right, so primary assessment. So can the patient talk, right? Can the patient talk and answer your questions? 99.9% of the time, that's going to be the case, right? Because we wear good helmets. And if you don't, wear a good helmet, right? So start interviewing, okay? What hurts? Where does it hurt? How bad does it hurt? On a scale of 1 to 10, 10 being the worst pain you ever had, what is it? Are you having any trouble breathing? And if they say no, you know that they can breathe, you know that they can talk, and you know that their mental status, they're in the ball game, right? They're not confused or unable to answer your questions. Okay? So, are you having any trouble breathing? We're just asking questions here. Nothing to do with first aid classes or first aid kids. We're asking questions, right? We want to know what is going on here. Is there any major bleeding? Stop the bleed, right? If you've ever heard that term, stop the bleed, if there's any major bleeding, you do that first, right? You stop the bleeding. You put whatever you need or whatever you can and whatever pressure, whatever you can, stop that bleeding. Is that going to happen? It doesn't happen very often. It's very rare, very rare that you have arterial bleeding, or venous bleeding that is, more of an oozing type of thing. But if it's bleeding, put something on it, right? Stop that bleeding. Extremities. Can you move all your fingers and toes? That's a question, right? I mean, can you move all your fingers and toes? What do you know from that, right? What do you know? You know that the extremities are being circulated with blood. You know that your nerve system is intact. Nervous system is intact, right? And so at this point, right, can you move your arms and your legs? What can't you move? All right, I got a little ahead of myself. But if there is no danger to the patient and others, take a moment to gather your thoughts, okay? Do your primary assessment, do your interview, gather your thoughts, write it down. There's nothing immediately that you need to do. You're going to want to fix it, but you're not able to fix it. Let me give you some advice here. There is nothing more dangerous, okay, in my eyes, than someone who with first aid training, paramedic training, EMT training, anybody that thinks that they can fix something, okay? If you have serious trauma, all right, the only people that can fix things are a trauma center and trauma doctors and trauma nurses. I'm married to one, okay? You have to get the patient to the hospital. Your number one priority may be, we got to move this patient to a place where they can get definitive care. That may be your plan, right? I want you to be able to determine that. Don't think that you can fix things or have to do things before, if part of your plan should be to move the patient in the direction of a hospital. Okay? So I want you to understand that. We're assessing here. We're initially assessing what the level of injury is. Your secondary survey. What is a secondary survey? Why is there two of them? Secondary survey is when you take your time and it's a hands-on palpation, starting at the head and doing exactly this, right? Palpating. Are you having any neck pain? No, I'm not having any neck pain. Palpating your clavicles, do you have any pain in here, or your shoulders, your arms, right down to the arms, and then chest. Push on the chest, if there's any, what they call flail segments, which is multiple broken ribs kind of floating in space, if you will, or fractured, things like that. Is the abdomen soft? Okay. In my case, very soft, right? The pelvis, okay? Pelvis, legs, right down to the toes, okay? That's what you do. And then when you find something, you write it down. And then come up with a plan, whether you need to splint it or treat it, or you just add that into your plan. Say, look, I've got multiple broken ribs on the right side. Sam's having a lot of trouble breathing. What would that tell you? our priority moved up to getting them to the hospital, right? You're not going to do anything, right, for it. You may put a pad around it and something that helps them feel better, okay, or a tight jacket or something. But other than that, anything to do with the chest, the abdomen, pelvis, things like that, you want to get moved from point A to point B, get them closer to the ability of people that can actually treat the injuries. So that's all it is. That's what secondary survey is. And we're recording everything on paper. Get someone specifically to record everything on paper, if not the person in charge, so they can transfer and communicate that information to first responders. All this stuff is way more important, okay? Way more important than you taking a first aid class and learning, how to do a particular task, because you still have to manage the scene and determine this stuff. That's what's a little bit concerning to me about adventure riders, saying, go take a first aid class. Let's all become first aid providers. You know what I mean? When you really need to know how to manage the whole scene, right? So secondary survey, basic hands-on gentle palpation, head to the toe, work your way towards the feet. Take a special care of the neck and the back if pain persists. If you can gently roll them on their side, put their arms out, roll them on their side, and palpate down the spine a little bit gently. You can determine whether there's a spinal injury or something like that, but don't take too much. It's a great time if you have to do that. Put a foam pad on. Okay, put a foam pad on the ground, or whatever you think you can. If you got to move the patient, whatever, sleeping bag or whatever, and then when you roll them back down, they roll back on a nice, comfortable surface. Okay, and if it's cold out, maybe on a sleeping bag or something of that nature. Okay, thumbs up. So extremity injuries, most of this stuff, most stuff is going to be extremity injuries, right? And I hope that is the case. Very few people become, permanent casualties from extremity injuries, right? They can be dramatic. They can be, challenging to our ability to stay calm. But I want you to understand the basic idea on how to deal with extremity injuries. And that's probably about as far as I'm going to go in terms of this goes. So upper extremities from a fall may include shoulder separations, arm fractures, wrist fractures, and hand trauma. If a lot of people walk around and have history of dislocated shoulders, okay, and they'll know, they will tell you, my right shoulder is dislocated, and they'll tell you how to reduce it as well. So if it's an isolated shoulder, things like that. If not, then you follow their direction, but I would just be very careful of that. The only time you really need to do something like that is if you don't, it's clotting off any blood supply. We'll get into that in a little bit. So we're talking about arm fractures, wrist fractures, very common, hand trauma, because we fall with our hands out, right? Fall with our hands out, and we get Colles fracture, little fractures in our wrist bones, because there's a lot of them. Lower extremities, femur fractures. You got to apply traction, things like that. That you'll learn in your first aid class. Very, very good, especially a wilderness first aid class. All right, and if I get in comments, we can talk about that. But femur fractures, knee trauma, or separation, torn connective tissue, ligaments, tendons, things like that around the knees, right? Athletic type of stuff. Lower leg fractures, ankle injuries, and foot trauma. That's probably what it's going to be. That's why we wear dirt bike boots, right? So, which make great splints. So I might be telling you this again, but I'm going to tell you this now. Be very slow to take somebody's boot off, because once you take a boot off and there's the ankle injury or foot trauma that's going to swell up, you're probably not going to get that boot back on. So just be mindful of that. How to assess an extremity injury. These things I want you to write down, and I want you to just, it's basic stuff, right? During your hands-on survey, make a note of the following and record findings. Can you find a pulse? Can you find your own pulse? Find your own pulse, okay? Find your own pulse. Do you know, okay, that if you have a radial pulse, you have to recognize what the speed is. Is it going really fast, or is it going just chugging right along, right? Chugging right along. And if you have a radial pulse on your wrist, okay, if you have a radial pulse, that means you have a blood pressure of at least 90. You're in good shape, all right? So a lot can be told from a pulse. Any numbness or tingling? Does it feel like the injured extremity is going to sleep? Right? Does it feel like something like that? Or is there no sensation at all? Like, I can't feel my right leg. I can't feel my foot. I can't feel it, right? It could just be from the trauma, or whether it's like a crushing type of injury or anything like that. It could be, don't go, oh my God, I need to do something. Just record it, right? Movement can or cannot move the extremity, right? Well, what that means is basically that you may not be able to move, just due to the fracture itself, right? It's because it causes a lot of pain because of the pain level. Anytime you have bones that are fractured, all right, and they're rubbing against each other or whatever, can be very painful, and they may not be willing to move. But again, can you squeeze my hands? Can you move your fingers? Can you move your fingers and toes? All that sort of stuff. You can do that. Your nervous system's working, right? So I want you to just go through and ask these things. If you get the ability to know where your pulses are, you have a pulse on the top of the foot. You got pulses in here. You got pulses everywhere. Matter of fact, you could just Google, where are all my pulses on my body, right? You find that stuff out for yourself. That's good stuff. Things to be cautious about, right? Removing boots or gear that provides a good splint. Like I just said, right? Your boots, unless you're in a dire situation or something, just leave the boot on for right now. Unless you need to look at the extremity, but you do it quickly because you might not get the boot back on. Moving extremities. If a fracture has occurred, it'll create added pain. If you have to straighten out a leg with light traction away from the center of the body to put it in the neutral position, okay? If you do that, it's going to cause a lot of pain. And in whatever you do, don't surprise the patient, okay? Tell them exactly what you're going to do and ask them for permission to do it. I have to move your leg. Okay, I have to move your leg to a neutral position. I want to do that. Do I have your permission to do so? Yes, you can do that. It's going to cause a lot of pain. Have somebody grab a hold of the inner part or closest to the core of your body. So when you straighten that leg out, it's not pulling the whole patient, right? That makes sense. So just be very careful of that. Only move extremities if needed to move a patient to a safe area. Okay, extract a patient or first responders or otherwise directed by them. They might tell you, say, I've got a severely angulated right leg. They might say, okay, put it in the neutral position. If there's no pulses, if the patient can't feel from the knee down, for example, or anything like that, you may have to, with light traction, move that extremity to a neutral position. All right. But if you don't feel comfortable with it and it's too much on the patient, remember, do no harm. Okay. So come up with a plan and what you're going to do. And you may need to splint it in the position found. Okay. You may say, okay, we're going to just splint it where it's at and do the best we can, or we're going to wait for first responders and let them splint it. Ashley Judd. Why am I bringing up Ashley Judd? She's an actress, right? You see her in all the different movies and things like that. It's a fascinating story, and I will not get the details exactly right for you guys, but it's a fascinating story. She was in the Congo, 5 to 10 years back or whatever. And she was there to just watch gorillas, right? To see the gorillas. They went in with a big team and things like that. She was jumping over a log and got her leg caught in the log and shattered one of her lower extremities. Broke it in multiple places. If I remember correctly, it was like 13 different places. Anyways, it was bad. It was a bad fracture. It took the team on a piece of fabric and 2 long sticks, all right, the porters that were with them, 48 hours. And we're talking about maybe taking brief rest, but a long time to extricate her to a hospital and where she could start getting treatment. They splinted the leg, no pain meds. I don't believe they had any pain meds. And it's a fascinating story of extricating someone out of the jungle in the Congo. And this is a very, petite, if you will, young lady who really had a serious leg injury. But the doctors, I believe it was in Nigeria, when they did surgery, they were able to save the leg. And to my knowledge, at this point, she's, still walking very well. So it can happen. But they came up with a plan. They did all this process exactly the way I'm explaining it to you. And you got to remember, too, we're not talking about applying a whole bunch of first aid, right? We're talking about managing the system. It's a great lesson on survival and teamwork. Thank you very much for watching. This was a long video. I'm sorry about that, but I really wanted to get this across to you guys. My name's Mark. I'm with Keith Remoto. I provide videos to you guys that can help your adventure motorcycling become a little more comfortable, a little less hazardous, and hopefully a little safer for you and your compadres, okay? You guys take care. Like and subscribe if you can. I appreciate it. You guys take care.